This is Jerry Hesch of the Hesch Institute in Aurora, Colorado. And this is some simple biomechanical advice that I give my clients. We don't have solid research that it's the right way to move. We don't have evidence that it prevents injury. My client feedback is that it's easier on their body, and I'm happy to present this. The first thing I want to do is ask my client how you bend typically. But march up and down. Bring your feet up and down. Good. Okay, and then stop. Okay, and then show me how you would bend down to pick up a pencil.
The old way?
Yeah, show me. Go ahead. All right. So that's a good system. You put one leg in front of the other and bend down, and that's a good system. Okay. And then the other way that I recommend that people bend is to bring your feet apart as wide as your shoulder and point your feet out a little bit. Good. And then you put your hand below the crease of your thigh. Put your hand on your upper thigh. Push the thigh backwards, okay? And so your bum is going backwards a little bit, okay? So initiate the bending there. Good, good. And then bend down. Nice, nice. So you initiate the bending by pushing the thigh backwards. Okay, the bending begins in the hip joint. Beautiful. Yeah, shoulders go forward, your bum goes back a little bit, and then you squat down. Excellent. Very good. Okay. Now we want to talk about twisting. So we're going to pretend you have to twist a lot to the right. You're fixing Thanksgiving dinner. Okay? I want you to point your feet forward first. Okay. And now, twist to the right. So you're preparing food and you have to put it over on the stove or whatever. Okay. So what happens when you do that is you use up all the motion in your low back. Low back injuries happen usually at end range. Okay? So if we open up movement in the ball and socket joint of the hip, then there's less stress on your low back. So the secret is you point your right foot outward slightly, okay? And now when you twist to the right, tell me how that feels.
More range of motion, less tension on the back.
Nice. More range of motion and less tension on the back. Yeah, you'll find that you could actually twist farther if you had to, because a fair amount of this motion is happening in the hip, not in the low back. Okay, good. So now we're going to translate that to sitting. So go ahead and sit. And I want you to bring your knees together and point your feet forward. Yeah, good. So we'll pretend you're in a restaurant and you need a salt shaker that's far away. So I want you to lean forward and get that salt shaker. Good. Do it again. Good. Okay. Now, open up your knees. Bring your knees apart a little bit and then point your feet outward slightly. Okay? And now, bend forward and get the salt shaker. Tell me the difference.
More range of motion and less pressure on the back.
Nice, nice. So simply opening up the knees and pointing the feet outward gives you more of the bending happens in the hip joint. Okay?
Yes.
The other way, the hips are locked and it's all lumbar. Okay, good. All right. Now, in this chair, your hips are a little higher than your knees, and that's good. So let's move you over to the sofa.
Put the pillow down.
Not yet.
You want me to sit?
Okay, yeah. So now you're sitting on this soft sofa, and your hips and knees are in a straight line. Okay? Bend forward. Okay? And now let's have you get up and put a pillow down. And now you're going to sit on a pillow so that now your hips are higher than your knees. How does it feel to sit this way?
Way more comfortable.
Yeah, immediately more comfortable.
Immediate more comfortable.
Yeah.
Yes.
And how does it feel to bend forward now?
less pain.
Yeah, yeah. And your feet are pointing forward.
Right.
You haven't opened, now you opened them, but
Yeah.
go ahead and do it with the knees pointing with the feet forward. Yeah, bring your knees together, good. And bend forward again, and you'll notice that's just a lot freer.
Yeah.
Okay? So yeah, whenever you sit for more than 15 minutes, if you can sit with the hips higher than your knees,
Yeah.
that's fabulous. Okay?
Feels good.
Yeah, there's some products of firm foam that are made for balance, for you to stand on, you know, to work on your balance. What I'm going to do is pull up that product
Okay.
on the internet, and I'll send you a link to that. So I'll put this on the camera in just a second.
So the other thing would be, put the legs apart, put my hands lean
Oh,
forward.
when you stand, yes.
When I stand,
Yeah.
and then go up
Yeah.
like that.
Yeah, I'll film that in just a
Yeah,
second.
I'm just practicing. It's so much information, and God forbid. Okay.
So this is one source of this balance device, and you can certainly do other searches, and you can certainly find them from other sellers.
Oh, I know what you're talking
Okay.
about now, yes.
Yeah.
They have them at the gym.
Yes, they do, yeah, yeah. It's a balance pad.
Just the pad, not the disc, the pad. you're
Right,
talking about.
right.
Mm-hmm.
So let me pull up this one. This one's only $23. And you have to write your name on it and put your phone number, because invariably you might leave it somewhere. And this one's 2.5 inches thick.
Okay.
Okay?
And
And
this
it's made for people to stand on it.
Yeah.
So it's thick foam, it's closed cell foam.
Yeah.
All right? I would buy 2 at a time.
Okay.
And keep one in the car, so when you go to a restaurant, and keep one at home.
Oh, so this is for sitting more than stand. Than,
This is for sitting on.
This is for
to raise your
balancing.
hips up high.
Okay.
So this is the balance pad, and the source is optp.com Pro Balance Pad, and it's only $23. So I don't know if doing a search is going to get you any better price, you know, but I recommend that for sitting on.
Okay.
Okay? Now, go ahead and show us how you get up from sitting. Let me get the camera on you, okay? So when you're sitting and it's time to get up, what you want to do, again, you're keeping your knees out, your feet are pointed out a little bit, and you're going to bend forward so your nose gets in front of your knees. Nose in front of knees, and push up with your hands on the thighs. And how does that feel?
Ease.
Real easy.
Very easy.
Yeah.
Yes.
Now do it without that. Just do it with your feet pointed straight. It's different.
Loading, a lot of
It
loading.
loads your low
here.
back, doesn't it?
Yes, it does.
Good, good. All right. So when you get in and out of a truck or an SUV, there is a grab bar. And probably the secret of good mechanics is to just do it slowly. When we rush, we tend to twist too much. Okay?
Okay.
So that's my only advice for getting into a truck or an SUV.
Yeah.
All right. But for a sedan, pretend that's the sedan and you open the door. Okay. So first you sit down. Okay. Now nope. Bring your leg in halfway. Yep, right there, halfway. Catch up with the other leg, and then go the other half
Oh, okay.
and catch up. Good. Beautiful. Getting out, bring your left leg halfway out, catch up with the other leg. Good. And then go the other half and catch up. And now you lean forward, knees are apart, and you push up with your thighs. Beautiful. So these are just a few ideas.
Yes.
You know, and therapists love to argue on the internet and claim that it doesn't matter, that this doesn't help people, it doesn't prevent injury.
It feels better.
It feels better to you with someone with low back pain.
Yeah.
And I think it's logical and common sense. And even if we don't have research that shows that it prevents injury, maybe it does in a small group, you know?
But I could see that it's more of loading in the hip joint and
True.
the hip flexors here and using this
Right.
as more of the mobile joint than putting the stress and the pressure on your back.
Yeah, yeah. So I find it worthwhile to teach, you know, to spend 5 minutes teaching my clients
Yeah,
how to move in this manner.
thank you.
So I hope it helps you, and I hope this is informative.
Thank you.
Yeah, thanks for letting me film.